Welcome to the Altais powered by Paladina Health provider meet and greet. Today is March 9th, 2021. It's just a little tiny bit after 4 o'clock. We're going to go ahead and wait just a little bit longer and allow others to join us. Hope everyone's having a wonderful day, and thank you for taking the time out of your schedule to join us today. We definitely have some great things to go over, and I'm very excited to introduce you to the providers if you haven't already met them. And if you have met them, then this is going to be old hat for you. So again, welcome. Okay, I think it's time for us to go ahead and get started. Can I get next slide, please? Today, we're going to go ahead and go over some of the benefits overview. We're going to, again, meet and hear from the providers today. We have a community health advocate that has joined us, and we're going to go ahead and let her introduce herself and share those services that are available to all of our MCSIG, Blue Shield of California, PPO, EPO members. We're going to show you how you can schedule an appointment with us. And at the end, we're going to go ahead and go over some FAQs and have a live Q&A with the providers. So at the bottom of your screen, you'll notice there is a Q&A. Please go ahead and populate any questions you may have. And when we get to the live Q&A, we'll go ahead and address those. Next slide, please. We're going to kick this off with a polling question. How do you typically utilize healthcare? Go ahead and take a moment and answer the question there. A few options. And while you're doing that, one of the things I probably should have mentioned is who I am. Sorry about that. My name is Melanie Salazar, and I'm actually the regional practice manager for the clinics here in Salinas and Monterey. So again, welcome. Thank you for helping us out here today. Okay, let's go ahead and see how we answered this polling question. Next slide. Okay, it looks like, wow, 53% of you have designated a primary care provider. That's fabulous. 13% of you are using the ER instead of a doctor. We'll work on that one. 33% of you go to the doctor's office occasionally. Looks like just when you're sick. Nothing wrong with that. And then 0% of you have never gone to a doctor. That's great. Okay, next slide. Here at Altais, powered by Paladina Health, we are, of course, a primary care service. We offer a variety of specialized care services that have been designed just for you. Again, I do want to remind you that the services here at Altais, powered by Paladina Health, are for MCSIG members that do have the Blue Shield of California PPO, EPO, and select plans. With that, you get access to your care providers, whether it's virtually or in person here at the clinic. Again, we have the two clinics, one in Monterey and one in Salinas. And of course, we'd love to see you in person. We love children, so bring your whole family. We would love to get everyone here in the clinics. You have access to your care team 24 hours a day, 7 days a week over the phone. This is for urgent needs. We offer same day and next day appointments. And what that means is that if your provider, your PCP is not available to see you and you have an urgent need, we are happy to schedule you with another provider, either in the same office or a different location. We can address multiple concerns in one visit. We schedule an ample amount of time for you to get to know your provider and for the provider to get to know you. They want to help you and address all the needs in one visit. Excuse me. We also have for you a behavioral health specialist here that treats adults, children, and provides family care. So please give us a call and let's utilize those services. Next slide, please. Again, we have two locations. In Monterey, we're located inside Ryan Ranch. And in Salinas, we are at North Main Street, where Highway 101 and North Main Street meet. So again, give us a call, schedule an appointment. We would love to see you. We do have a variety of hours to accommodate both clinics. So hopefully one of these works for you. Give us a call. Next slide, please. We have a multitude of ways where you can access your care. I know some people are still very concerned with COVID. We understand that. For those people, we do offer virtual care or telephone visits. If you're feeling safe, we offer in-person visits, which we would love to do for you. We have a variety of services that we can accomplish during these visits. We have full access to scheduling. You can do it from your computer, from your cell phone. You can do a video call, a telephone call. There's a variety of ways to get in touch with us here at the clinics. We also offer comprehensive care. We're doing preventative well checks. We have mental health screenings. We can service urgent needs, chronic conditions. There really is a lot that we can take care of here at Altais, powered by Paladina Health. For your follow-up visits, as you can see, we can do them in person. We can do them over the telephone. Again, a variety of ways that we can assist you. We have a in-house pharmacy. We can do labs here in the clinic to prevent you from having to sometimes go to an off-site facility. So, check us out. Next slide, please. Some of the primary care services that we provide here in the clinics are for adults. Well, they're all for adults and children. We do have staff that speak English and both Spanish. A couple of our providers are both fluent in English and Spanish. We do have medical assistants that can assist with the providers that are not Spanish speaking. But some of the services that we are providing here, as you can see, are the preventative care, the well visits and physicals. We can assist with urgent needs, the sick visits, the chronic condition management, vaccines and immunizations, which I'll come back to in just a moment. Health screenings. Prescriptions, again, are available on site. The lab work available on site. And then when it comes to a off-site specialty referral, we do our best to keep you in your network with Blue Shield of California to help maximize your benefits and, of course, save you the most amount of money and not jeopardizing the quality of care that you deserve. In regards to the vaccines, I do want to touch on the fact that we are in the process of trying to get the COVID vaccine to administer to our members. The order has been placed. We are following the CDC guidelines, and just so everybody does know, we are low on the totem pole as far as potentially receiving it because we are a primary private facility. We are recommending that all members register with the Monterey County Department of Health and receive your vaccine there if you can. As soon as we receive any communications from the health department that we will receive the vaccine, communications will go out and we will open up to scheduling for those appointments. Next slide, please. In regards to behavioral health services that are available for adults and children, these are simply just some of them. We have Dr. Livingston on board with us, and he is our clinical psychologist, and he provides the health psychology services, cognitive behavioral therapy, anxiety assessments, depression assessments, addiction assessments, and psychological treatment. There's OCD assessments and treatment. He also provides treatment for the domestic violence and PTSD. He's happy to work with people for anger management. And again, if some services are outside of his scope, then we'll of course refer you to the appropriate facility. Next slide, please. And I do see that some questions are coming in, so please keep posting your questions and we'll go ahead and get to those in just a moment. Thank you for that. So what are members saying about us? This is actually a very exciting thing to share with you. We have here, I am extremely impressed on how fast I was able to make an appointment. I look forward to seeing the doctor for all of my regular visits. Another person says, ask all the right questions, making sure I felt comfortable answering my question. The doctor took the time necessary to address all my health concerns. Another patient says, I appreciated the efficiency of the process and the ability to see the doctor within a day of contacting the office. The facility was professional and staff was generally friendly and efficient. These are just some of the things that members are saying about us. And, we would love to have you schedule a visit. So you can share some of these wonderful comments with us. Next slide, please. It is now my pleasure to introduce you to our wonderful providers. And we're going to go ahead and kick this off with Dr. Gabriel Alor Khan. Dr. Alor Khan.
Good afternoon, everyone. Thank you for joining us this evening. I'm Dr. Alor Khan. I'm a family medicine doctor who provides family medicine, and that encompasses adults, children, both sexes. We do all types of comprehensive care. We do all the standard treatments, high blood pressure, cholesterol, diabetes. We do ill visits. We see children growing up. We see babies all the way through their life. One of the things that I want to tell you is that I joined Altais, powered by Paladina Health, because, and you're going to hear this a lot, because of the time they allow us to take with the patient. You are well aware of how many practices have to maximize the patient load, and that only means 5 minutes with you tops. Here we are allowed to take much longer time to get to know you better, get to know your needs better, and get to treat you better. Our goal here is to improve your health, and that's what we hear. I hope we have offices both in Monterey and Salinas, and as you meet the rest of the staff, you're going to see how dedicated we are at helping you improve your life. Please make an appointment, come and see us, and hope to see you soon. And thank you.
All right. Hi, I'm Michelle. I am the physician assistant here with Altais, powered by Paladina Health. My background is in primary care and urgent care medicine. Similar to Dr. Alor Khan, I came here with Altais, powered by Paladina Health, because I really felt that their model would enable me to spend quality time with patients and to really get to know each of my patients and address their health concerns. I also really like that here at our clinics, we have a clinical psychologist and a community health advocate. So we can really address not only your physical health, but mental health and any social needs as well. A little bit about me. I am originally from the Monterey area, so I'm really happy to be back here and be practicing as a PA in this community. I love to be outside, go hiking, and just explore the beautiful area that we live in. I hope you all can learn a bit about our practice from this webinar, and I look forward to meeting several of you in the future. And I'm going to go ahead and pass this off to Sarah next.
Hi, everyone, and thank you for being here. My name is Sarah Kahani, and I'm a family nurse practitioner based in the Salinas office. With my public health background, I'm a strong advocate for preventive medicine, and I enjoy working with patients to individualize their care and to cater to their needs and obtain positive and realistic health outcomes. I joined Altais also because I love the appropriate amount of time to obtain patient goals. I've had several patients that I've seen for acute same-day visits that have inevitably switched their PCP to an Altais provider. And several new patients have also been able to schedule sessions with our clinical psychologist after wrapping up their visits with me, and they've avoided having to find a therapist with an open schedule on their own. In my free time, I enjoy traveling and exploring my surroundings through nature and food, kickboxing, and paddleboarding, and I'm looking forward to meeting you all. Next, we have Dr. Simon.
Hi, everybody. Little mute problems there, sorry. So I'm Dr. Simon. I would love to be able to see you all because I'm hoping I'm seeing some familiar faces. Although I'm originally from the East Coast, I've been in California for way too many years. That would indicate how old I am. So a long time. I've been practicing in Salinas for, this will be my 11th year, 11th or 12th year. I too am a family medicine doctor and love to see littles and do women's health. I also have interest in integrative medicine and lifestyle medicine. So as Dr. Alor Khan told you, you're going to hear from all of us that we really work on looking at the bigger picture and people and really getting to know people for their stories and their individual needs so that we can customize the best healthcare plans for each person. I'm working in the Salinas and Monterey offices alternating days. Yeah, look forward to seeing you. I'm hoping that some of you guys are my previous patients and we can hook up again. So that would be great. And I'm off to next. I hear somebody talking. No? Okay. All right, I'm going to pass it off.
I think that's me. Hi, I'm Dr. James Livingston. I'm a clinical psychologist and I have been a psychologist for over 40 years. So I've had the opportunity to work in a bunch of different settings in hospitals and private practice and community clinics and even a jail and a prison. My longest employment was as a psychology professor, where I trained clinical psychology graduate students to be psychologists. And that was very fun. But my heart has always been with clinical work. And so I left that actually to move to the Center for Survivors of Torture in San Jose, which provides services for refugees who are tortured in their home countries. So I have a lot of experience with trauma and treating trauma and also with immigration issues. I love working at these clinics. I'm able to work both at Monterey and in our Salinas clinic. I'm working with medical providers, and that is such a luxury for me in that in various other forms of practice, I've not had the opportunity to coordinate as well with health providers. I'm accustomed to working with psychiatrists, but not with folks who are involved with general medical issues. And that is so helpful to me to be able to consult on those kinds of issues. So it's been a pleasure. I've really enjoyed working at the clinics with my colleagues and also with our health advocate, which is also a luxury to be providing our patients with the community resources that are available. So it's been great fun for me. And I hope that you guys will consider coming in. There is, of course, we have a medical pandemic. We also have a mental health pandemic. Around the world, people are suffering from isolation and the consequent issues, often depression and anxiety. And to the degree that I can be helpful to you, I want to be. So please utilize our medical and mental health services, and we'll see how we can help out. So I would like to introduce you to Jenny Pelagio, our community health advocate.
Thank you, Dr. Livingston. Hi everyone, my name is Jenny Pelagio and I'm the community health advocate with Altais, powered by Paladina Health. And I work with your healthcare provider to connect you with any community resources to address non-medical health needs. So this could mean if you are having challenges with food insecurity, transportation access, mental health resources, you would like some help with your lifestyle management or care coordination, I am here to work with you. And for now, you won't see me in the clinic, but I am available by phone during business hours. And to work with me, you just need to let your medical provider or your medical assistant know that you're interested in working with the community health advocate. And to remind you, this service is of no cost to you. I will schedule a phone appointment with you and I'll be in touch with you soon. A little bit about me, I completed my undergraduate degree at UC Berkeley, and I really care about gender and racial equity in healthcare. On my free time, I enjoy exercising, going on long walks, reading, and I feel truly honored to work with this clinic in this community that is my own. And so I hope that you can make an appointment with us in the next couple of weeks and that we can see you at our clinic.
Are you ready to make an appointment yet? You can give us a call here at Monterey Clinic or at the Salinas Clinic. The numbers are posted here for your benefit. That doesn't work for you, please give member services a call at 1-866-808-6005 or visit us online at members.paladinahealth.com. You will have to set up your account and register. Once you are registered and it's complete, you can go ahead and schedule online. We do encourage you to create that online portal account. Through that portal account, you have access to your members, or excuse me, to your provider care team 24/7. You can see your labs, again, schedule visits, communicate through messaging. It really is an efficient and effective way of communicating with us here in the clinics. Next slide, please. What to expect when you come in the clinic. As you all know, we are in the middle of a pandemic still. And for your protection, as well as our staff, we are staggering appointments. We do ask that you wear a mask. We would also ask that when you arrive to the clinic, that you call us from your car to announce your arrival, and we'll let you know when it's safe to enter the facility. Please have your identification and your insurance card ready. This way you're able to avoid touching too many surfaces when you walk into the clinic. As soon as we take your temperature, we check you in, we go over some COVID questions. We'll quickly escort you to your exam room. We again have arranged the furniture around the facility to protect you and another member because of social distancing. We are thoroughly sanitizing all of our rooms in between each and every patient for your safety as well as ours. Next slide, please. Okay, some of the frequently asked questions that we get here in the clinic are, who is eligible to access the clinics and the services? It is all MCSIG members and their dependents that reside in or work in Monterey County and that are currently under the Blue Shield of California plan. That is the PPO, the EPO, and the Select. Another question that we get is, can I keep my existing PCP if I see an Altais powered by Paladina health provider? And the answer is yes. We, of course, would like to be your primary care provider and your only primary care provider, but we do understand that many of you have established relationships. And if that's the case, please consider us as a second source for your care. Maybe eventually we'll win you over. Another question we get is, does it increase my healthcare costs if I use the services? The answer is no. It will not increase your out-of-pocket cost. Your copay remains the same as if you were to see any other in-network Blue Shield of California provider. We do not collect copayments here in the clinic. You will receive a statement at the end of the month for the services that were rendered in the prior month. So please keep that in mind. Is the virtual care services like Teladoc? We actually have received this one quite a bit. We are not Teladoc. We are primary care that is available for you through your, again, telephone or virtual visits or in person. So it is slightly different, and we do offer a broader scope of care that we can provide. Next slide, please. All right. This is probably some of my favorite stuff here is the Q&As. So I'm just going to go ahead and read some of the questions that are coming in. We have many of them coming in, so thank you for that. One of the questions we have here, which we just touched on, was Monterey County members. Do people who reside or work maybe outside of Monterey County have access to the clinics? And the answer is yes. So long as you are a MCSIG member or a dependent, you have the Blue Shield of California EPO, PPO select plans, you are eligible to utilize these clinics. And we, of course, would love to see you regardless of where you live or work. Another question is, can we schedule behavioral health without a referral from a primary care doctor? Which one of my providers would like to answer this, please?
I can answer this one. So yes, you can schedule with behavioral health without a referral. So you could call one of our clinics and ask to schedule with Dr. Livingston. Another option is if you see, if you are coming in for a physical or another reason to see another provider, you can always indicate to us that you would like an appointment with Dr. Livingston, and it's easy for us to set that up for you.
Thank you, Michelle. We have another question here. Monthly bill will not come through the portal or email. The answer is no, it will not. It will arrive snail mail, the old school method. And then as soon as you get that statement in the mail, you can call the 800 number listed on the statement, and that'll connect you with our billing department so they can go ahead and take that co-payment. The type of payment that we can receive is you can mail in a check. You can call us with a credit card, a debit card, and you can use your HSA as well. What are the office hours? I know we have that on another slide, and I apologize, I don't have the clinic hours right in front of me, but maybe we could go backwards and take a look at the clinic hours here. In Monterey, I can tell you that on Mondays and Wednesdays, the clinic is open from 6:30 in the morning to 4:30 in the afternoon. And on Tuesdays and Thursdays, we're open 10 a.m. to 6 p.m. Fridays is 6:30 to 10:30. And here we have the Salinas hours, which are quite varied, but we have Mondays and Wednesdays, 6:30 to 5:30. Tuesdays and Thursdays are 7 to 6, and Fridays are 6:30 to 12:30. So hopefully we can accommodate all of your needs during those hours. Another question we have here is, are you available to non-MCSIG but Blue Shield members through CVT? The answer to that is yes. So it's kind of a strange question, but CVT members who have Blue Shield of California, PPO, EPO, and Select also qualify to utilize the clinics. I hope that answers the question. If it doesn't, feel free to post another one and we'll go ahead and address it. If we are not due for a yearly preventative checkup, can we come in if we are ill or need medical care, even though we are not set up with your business? Can I get a provider to answer that, please?
That's a really good question. Yes, you can definitely see us for an acute visit if you've never established care with us before. You don't need to schedule a physical in order to be seen for an acute visit. And You may get a call from one of our medical assistants, or when you call for the appointment for the acute visit, we may go ahead and get a lot of your medical history over the phone. But yeah, you can definitely schedule an acute visit with us without having been seen before.
Thank you for that, Sarah. We have another question here. Do you offer OB care for expecting mothers? Provider, please.
I'll take that one. So we can do first trimester prenatal care. So diagnosis of pregnancy, first OB visit, which includes usually all the labs and that first physical exam, and referral out beyond that. We don't have the technology in the clinic to continue care through, and we are not delivering babies in the hospital, so we will refer you out to somebody who is doing deliveries. And I was going to actually answer another question, and now I just lost it, so we'll skip that. Sorry.
Okay, thank you, Dr. Simon. We do have another question here. Oh, before I get into this, I did wanted to just remind everyone, if you signed on maybe a little bit late, or maybe I haven't said it, so I apologize. This webinar is recorded and it will be available later for viewing. We'll definitely be sharing this with MCSIG, okay? So please refer back to it if you have any questions. Another question here, should we get medical records transferred, or can you request them digitally from another primary care physician? Provider, please.
Actually, we can certainly do that, and we prefer it that way. We work on your getting to know you better, and that's why getting those old records to us is very important. I know some practices do charge if you request them yourself, and that's why you should allow us to request it for you. Should be no cost to you if we request them from your previous doctor. Hope that answers your question.
I wanted to pop back on also, and because I remembered the question was about COVID testing, and wanted to let you all know that we do offer COVID testing in the clinic. We have about a 2-day turnaround time. So if we're testing you in the afternoon, we're usually getting it not the next morning, but the morning after that. There's a lot going on with COVID vaccination right now, but we are encouraging people who are symptomatic to continue to get testing. So do know that that's a possibility with our clinic.
Thank you, Dr. Simon. I did want to let everyone know that should we be chosen to receive the vaccine for COVID, the one that we'll most likely get is going to be Moderna. I know that there's been some interest out there for the Johnson & Johnson, but we will not receive that one. I just wanted to put that out there for you. And again, encourage everyone to please, contact the Monterey County Health Department and schedule your appointments, as they are currently vaccinating educators at this time. We did get a couple more questions coming in here. One of them is, what's the average appointment time you take to see patients? Can I get a provider on that, please? Thank you.
So it depends on the type of visit and if you're a new patient or established. So our new patient physicals get an hour and a half, so 90 minutes, which is very different compared to other primary care offices. And for a new patient acute visit, it's 45 minutes. And then once you've established care with us, a physical changes to 60 minutes and a follow-up appointment changes to 30 minutes. However, the providers have the capability to extend your visit as needed. If we feel like we need more time with you, we can certainly arrange for a longer appointment.
Thank you, Sarah. We have another question here. What is the site to set up an account? I'll go ahead and take that one, non-clinical. It's members it's members / paladinahealth.com. You can go there, register, set up your account, schedule your visit through there. Be sure when you register for a new account that you select the clinic you want and you select the primary care provider that you would like to see. It helps us with scheduling correctly, and don't let the system default you to someone that you may not want to see. But anyways, yes, members / paladinahealth.com is where you can set up that account. I hope that helps you out there. It looks like that kind of wraps up our questions here, unless anyone has anything else that we can address for you. If I could get the next slide, please. I do want to take the time and thank everyone for joining us today. It's always a pleasure to introduce you to the providers that are, working hard to make this a better experience and provide the most exceptional care that we possibly can. If you have any questions about anything, please visit us, paladinahealth.com /MCSIG. And again, the patient portal to set up your account, and I apologize, I said it wrong earlier, it's members.paladinahealth.com. So go ahead and give us a visit, and we hope to see you soon. Thank you so much for joining us today.